Just look at this picture and you can see that a trawler full of sugar cane, and look the arrangement of the sugar cane in the trawler. You can see that these are hanging dangerously in all directions, and when a person overtakes it, especially on the bike, they can get a trauma. So this young lady, a newly wed bride, she was on a bike, and when they were crossing the trawler full of sugar cane, her eye was struck by a sugar cane and she got sudden decrease of vision, and she came to me. When I examined her, she was first seen by other ophthalmologists, and then she came to me. So I saw, you can see traumatic ectopia lentis. There was iridodonesis, tremulence iris, phacodonesis. Lens was also moving due to broken zonules superiorly, and here you can also see, and her vision was counting finger. On fundus examination, retina was intact. So she got traumatic ectopia lentis. Now in this view it is clearly evident that almost 12 clock hours zonules are broken and lens is displaced anteriorly and inferiorly. Now the first ophthalmologist didn't check the intraocular pressure, and when I checked, the intraocular pressure was also in 40s. So I gave her anti-glaucoma drugs as well as steroids, because there was inflammation as well, and I gave her pilocarpine. And now after 2 weeks, you can see her, she visited me again, and you can see that now her pressure is 12, and her vision is also increased up to 636, and still there is vitreous at 3 and 9 o'clock, but her pain improved, intraocular pressure improved, and so far lens is transparent and she is able to see. And now as the pupil is constricted, so there is not much tremulence as well. So first, when there is ectopia lentis, the first treatment option is medical. Give her constrictor drops, pilocarpine, and see that if her vision is satisfactory, then you can continue conservative treatment. If you see, and you should closely follow such patients like monthly, and if you see that there is a complication, the zonules are getting damaged, the lens is getting displaced, then you can intervene and perform complicated anterior cataract, anterior segment surgery with phacoemulsification, anterior vitrectomy, and CT or CTS implantation, or sometimes you have to perform a scleral fixation in such patients. So take home message is that always, even if the driver is wearing helmet, the passenger should also wear helmet, and you can avoid this trauma. I have received so many patients of sugarcane trauma, and this young lady, almost 20 years old, was one of them. Now her pain is settled, but still her vision is 636, and she may need surgery in future. So take home message from this traumatic ectopia lentis patient is that always check intraocular pressure, always give anti-inflammatory drops, pain relieving drugs, and always wear helmet while driving bikes. Thank you very much.